Good evening. We're going to go ahead and get started. Thank you for being here. My name is Ashley Giles. I'm the advocate for the aging with Henrico County. I'm so happy that you're here. We know that, and I said this last week too, caregivers really are the backbone of our community. The work that you do is really important and it doesn't go unnoticed. So just grateful that you're here with us tonight to learn about some more resources and ways to support your community, your family members, and loved ones. I did just want to introduce, we have a new agency that I'm a part of. It's our new Outreach and Engagement Office through Henrico County. And our vision really is to have Henrico be a place where everyone is thriving. So again, so grateful that you're here to join us. I do want to introduce a wonderful resource. We have Darius Bradshaw here with the SPAN Center, which is formerly Senior Connections. It's our local area agency on aging. And I just wanted to give him just a minute to talk about some of the resources that he is providing, that the SPAN Center is providing our caregivers in our community. You have a minute?
I will be quick and fast so we can slip in your nitty-gritty of this stuff. So again, my name is Darius Bradshaw. I am the Caregiver Support Specialist at the SPAN Center. What I do there is I help caregivers find resources for getting some breaks in there, because we all know caregiving is a shameless job, so we help that with that. I'm also a listening ear. I tell people all the time, even if you have to call, scream, cry, whatever you need to do, I am there for you guys to walk through this journey with you. So that's really what we do there. We have some amazing resources that we can chat more about. I will be hanging back with everyone. So if you guys need anything or would like to talk about anything, I'm here. And again, my name is Darius, and it's a pleasure to meet all of you.
So our topic for this conversation is supporting your loved ones as their abilities change. And we are joined by Lisa Isbell with Senior Care Authority. I'm going to read her bio really quick for you all. She's impressive. Lisa is the owner of Senior Care Authority of Central Virginia and a frequent speaker on senior living and aging topics. She and her team have worked with countless families and older adults to help them navigate care and living needs since opening in 2017. Following a career in financial services and church administration, Lisa opened Senior Care Authority of Central Virginia after experiencing the transitioning care needs of her own parents. Knowing that finding the right care and living options for your loved ones can be stressful and frustrating, Lisa and her team work patiently with families, educating them on the many options available in our community. Working with a wide range of experts and local resources, Lisa and her team help make the transition to care a smooth one for seniors and their families. Lisa received her undergraduate degree from Mary Washington College in Fredericksburg and her graduate degree from the University of Richmond. She's a certified senior advisor as well as a certified dementia practitioner and a certified Alzheimer's disease and dementia care trainer with the National Council of Certified Dementia Practitioners. Lisa's an instructor with the Osher Institute at the University of Richmond and serves as a community educator with the Alzheimer's Association. She and her husband, Scott, have 2 children in college and a new puppy. I'm gonna let you come up, Lisa. Thank you so much.
I have to update that bio. My kids are older now. One of them is graduated and has her master's and is a social worker. And our son is graduating in May, so the tuition bills will not be coming anymore. So that's exciting. Thank you all for coming out tonight. I appreciate Ashley inviting me and the opportunity to talk to you all. And she did a great job of running through the bio, so I'm not going to get into all that. This is what Senior Care Authority does as a company. Basically, we're an elder care consulting company, and we work with older adults and their families to help people who are trying to figure out care options. So that is what we do. We're based here in Glen Allen, but we work throughout Central Virginia. I am going to pass around. We have a monthly newsletter that we put out by email. I'm just going to pass around a thing. If you guys are interested in that, just give me your email address and we'll get it out to you. We don't share your contact information or anything like that. This is just a monthly thing that we put out about local information if you'd like it. So tonight, we are here to talk about supporting your loved one as their abilities change. And that's a topic that a lot of people deal with in varying degrees. And unfortunately, the approach that a lot of people take is to bury their head in the sand. And they feel like, well, if I don't think about it, it's not going to happen, right? But unfortunately, that is often not the case, and oftentimes that can make the problem worse. So let's start off tonight talking about some signs that your loved one may need some help. Here we go. So first up, spoiled food or lack of food in the home. That's a pretty typical one. So if you go into somebody's house and you see their kitchen is pretty bare, or you look in the refrigerator and things are way out of date, those can often be signs that they might need some help. Unintended weight loss or gain, which can be directly related to the food issue. People who are dramatically losing weight can be for a variety of reasons. One can be a medical cause, but secondly, oftentimes it's because of a potential cognitive issue, and they are unable to cook for themselves, unable to use a microwave anymore, things like that. So weight loss and sometimes gain, especially if they're not eating nutritious meals, can be an issue as well. Another one is unfilled prescriptions or medication misuse. That's probably one of the #1 reasons people start to receive care is medication management. They are not taking their prescriptions properly, which can lead to all sorts of other issues. So that is one to definitely be on the lookout for. Another one is past due or unpaid bills. A person is unable to keep up with their finances anymore. And, you know, so they either ignore the bills, they double pay the bills, you know, there's just general financial problems that start. Also related to that would be excessive donations to questionable causes. That can be one, you know, there have been countless articles and information about scams that target older adults, and unfortunately that happens all the time. I mean, every day people get attempted to scam older adults, whether it be by mail, by phone, by text, you know, any way possible that they can. Okay, physical frailty and or falls. That's also a very common one. A lot of this is tied together. You know, physical frailty can come when a person's not eating properly. People can fall when they're not taking their medication properly. So a lot of these things are linked together. Another one is changes in mood, personality, or demeanor. You know, sometimes a person just, you know, goes from being very outgoing to being very quiet and introverted. Sometimes, you know, they just completely withdraw from family. So anytime there's a significant difference in their behaviors, that's something to look into. Another often very visible one is that their home or their yard is not taken care of. I was at an appointment last week, and you know, it was obvious that this woman could not keep up with her house. It was just overgrown, and she had these brick stairs going up to her house that there was probably a 6-inch gap between the steps and the house. And several of the bricks had fallen out. And then when you go inside the house, it's just dirty and not kept up because she's unable to do so anymore. So that's a pretty typical sign as well. Another one is that a person is very disheveled in their appearance or they're lacking hygiene. They are wearing the same clothes every day. They're not taking a bath or a shower regularly. And it seemingly is not something that they really notice that's a problem. And then finally, the last one is missed appointments. And these are not just, oh, I forgot the doctor's appointment. These are major family events, like a graduation or a birthday party or, getting together with family members that the person just completely forgets about. So these are all examples, certainly not a comprehensive list, but these are all examples that are indicators that a person may need some help. So the biggest thing that you want to do is not do what the previous slide showed, which is bury your head in the sand. But these are issues that need to be addressed, and you need to share your concern with a person. It doesn't help anybody if a situation is just ignored and you hope it's going to get better, because chances are very high that it's not going to get better without some intervention. And hopefully it may be something as relatively simple as making sure the person's taking their medicine properly, setting up a medication dispenser for them, or things like that that can help them, or helping them with meals, things like that. Those are relatively simple solutions to some of these problems. But the point is, if you ignore them, they're not going to get better. And unfortunately, it often ends up in a tragic situation if a person is left alone to continue in that pattern. We've all heard on the news in the past week or two the tragedy of Gene Hackman and his wife. That's just an awful situation that I think a lot of the details are still coming out, but this is a person who is everybody knows who Gene Hackman is. He's this internationally known actor, and for a person like that to end up in such a tragic situation is just awful, as well as his wife. So again, how do you share that concern? Number one, don't ignore it. Secondly, approach the person, but do it. You've got to be really careful about how to approach a person, because oftentimes they are going to be defensive. So you have to do it calmly, rationally, non-judgmentally. And when it's a family member, that can be really hard. But you have to time it right. Don't do it when the person is tired, or don't do it when they're in the middle of a group and they feel like they're being ambushed by a group of people. Approach them, especially if this is a situation where it's an adult child approaching their parent. Approach them as their partner, not as their parent. Because no matter how old a person is, if you have a 90-year-old with cognitive impairment, they still don't want a parent. You have to approach them with dignity and respect for where they are in life. And if you're not the right person, if they can't receive it from you, involve somebody else that they trust and they respect. Particularly for older adults, a lot of times that's their doctor. It's somebody they've had a relationship with for a long time that they trust. So sometimes their primary care doctor is the right one to have the conversation with them. Sometimes it's their minister or somebody from their church. Those can be people that can help them or approach the situation with them. Another option, if those two things aren't an option, is use a neutral third party. Use an elder care consultant. Use a geriatric care manager. Somebody like that who can approach them and kind of be Switzerland in the situation. They're the neutral third party. And you may be surprised. You may be absolutely dreading the situation, and then it turn out much more positively than you think. I had that situation a couple of years ago. My mother is 89, still lives independently, but she needs some help. And so, she was having problems with her finances. She was writing checks the wrong checks to the wrong person, or she'd mail the wrong check to the wrong person. She was transposing numbers, things like that. And so I approached her and said, you know, reminded her of the issues, tried to do it calmly. When it wasn't a bad time, we were just one-on-one. Honestly, I was dreading the conversation. But it went much better than I thought it was going to do. And she acknowledged that she had an issue. She knew she was having problems, and she welcomed the help. You know, has it been all smooth sailing? No. But the point is she's receptive to the help, and that's the key thing. So the goal in all of this is having the person be in a safe living environment. For most people, again, most people want to avoid these conversations because it is a challenge. But why do you have to have them? Again, it's so that people can continue to live safely and there is not some tragedy. And unfortunately, Ashley sees this all the time. I see this all the time. A lot of times, people don't get help until there is some tragedy and they end up in the hospital. They've fallen and they've broken a hip. I had one 2 weeks ago where a person called me and his dad was living in an independent living community, but it was very independent, and he found him. You know, his father had been on the floor for 4 days when he found him. So pretty miraculous that his dad was still alive at that point. But that's why it's important to get involved. You know, we hear the statistics on the news every day. Our population is aging. 11,000 baby boomers turn 65 every day. 1 in 5 Americans are projected to be 65 or older by the year 2030, which means people 65 and older, for the first time in American history, people 65 and older are going to outnumber children. So planning is really important because it's projected that over 70% of adults 65 and older are going to need some type of long-term care at some point. That doesn't necessarily mean, you know, in a nursing home, but it means that they are going to need some ongoing care, at least for a period of time. So the important thing is to plan. Now, when you talk to people about where do they want to receive help, where do they want to get care, almost everybody says they want to be at home. They want to stay home, but the key thing is, how do you stay home safely? So here's a few things to consider. One, you have to look at where your home is. Is there access to quality caregivers where you live? Now, if you live around here, yes, there absolutely are caregivers that you can tap into around here. If you live, I've had, I don't know, 3 or 4 people lately who call me from Louisa, from Quinton. There's not too many options in those areas. And so that's something you have to factor in on. Are there caregivers even in that area or willing to drive to that area? And those caregivers would be both companion care type caregivers as well as personal care type caregivers. So that's a really important consideration. A lot of times people just make the assumption that their family is going to help them out, or their friends, if they have close friends. Don't assume that. You know, you have the conversation with them in advance and see, are you able to help me? You know, if you have kids who live 30 minutes away from you and work full-time jobs and have young children, their time is going to be pretty limited too in terms of the care that they can offer. Or, you know, it's so typical today, people are spread all over the country. You know, it's almost rare to have people whose family lives close to them anymore. So you have to have the conversation up front. Just don't make assumptions on that. Another thing to consider is who's going to manage the caregiver. This is especially important when the person is living alone in their home. There's not a spouse there or anybody else. So yes, you can hire caregivers to come in, but somebody's got to manage those caregivers. And who's going to be the point person on that? Who's going to be the backup if it snows and the caregiver can't get there? Or if the caregiver's child has COVID and they can't come that day? You know, there's got to be a backup plan in place. The next one is financial resources. Are there resources to pay not only the caregiver, but if you're still living at home, you've got to maintain your home. You've got to pay the utility bills and buy groceries and all the things that go into living at home. People are often very surprised to find out the cost of caregivers coming into their home, and the fact that oftentimes it's much more expensive to have caregivers coming in than it is to go outside their home into a senior living community. The average rate for caregivers in the home in the Richmond area now is about $35 an hour. So if you add that up, if somebody had full-time caregiving in their home, it would be over $23,000 a month. Not very many people can afford that for very long. So those things have to be considered. Another issue is the social component. Are there opportunities for social interactions outside the home? You know, one thing COVID taught all of us is the danger of isolation and how much we need to be around other people and have those human connections. So for an older person who is clinging to this idea that they are going to stay in their home forever, one thing you have to explore with them is, what is home? You know, is it this physical building that you're attached to? Is it the routine and the memories in this house that you're attached to? Or, you know, so you have to talk about that a little bit, because sometimes for a lot of people, their home becomes almost a prison because they are so attached to the concept of the home and of all the memories there and the kids that they brought up in that home and their spouse who was there and all the things that go into that. But sometimes it really does become their prison. And I've worked with people that it's literally their prison, who, you know, they're unable to move around in their home anymore because of stairs. So they're limited to one section of their house. So that's something to consider too. But the ability to leave the home and to interact with people is really critical. Sort of related to that, modifications that the home may require is another consideration. How do people manage the physical challenges of their home? Are there stairs? Is there an accessible bathroom? A lot of older homes have tubs, and if somebody's using a rollator or a wheelchair, or, even these older houses have very narrow doors a lot of times. So those are all things to factor in to the home. And then opportunities for meaning and purpose. That kind of goes along with the social interaction component, but people have to have a purpose in life and something to look forward to and something to feel like they're contributing to. It's not just, let's sit around and watch Wheel of Fortune all day. You know, there is more to it for most people, and even older people with diminished capacities physically or cognitively still need a purpose in their life. So, so those are all things to consider for the people who are who want to be at home, which again, I would say 98% of people, when you first have that conversation with them, everybody wants to stay in their home. But you have to drill a little deeper and see, is it feasible? So if you're kind of going through all this and you're thinking about it in your head, like, maybe that house setup isn't so great, there are other options out there to be aware of. When you talk about senior living, what's the first thing that comes to everybody's mind? exactly. Nursing homes. Nobody wants to be in a nursing home. Nobody. And it is everyone's greatest fear, I think, that they're going to end up in a nursing home. A lot of people still call them old folks home. They're not even really called nursing homes anymore. They're called SNFs, or skilled nursing facilities. I guess it makes it sound a little better. But the thing to keep in mind is that skilled nursing facilities really have two sides to them now. There's the rehabilitation side, and then there's the long-term care side. So the rehab side is where people go for oftentimes after they're discharged from the hospital. If they've had a fall, if they've had a stroke, if they've had hip replacement surgery or knee replacement, and the doctor says, okay, you need to go into rehab for a couple weeks. That's where they're going to go most of the time, is into a skilled nursing facility where they're going to get physical therapy or occupational therapy, sometimes speech therapy if they need that. So that's one side of the building. And Medicare will usually pay for a short-term stay for rehabilitation. The way that it's set up, the combination of Medicare and your supplemental policy will pay for up to 100 days of care. Now, very few people actually get the full 100 days, but that's the number. So again, that's the rehab side of the building. The other side of the building is the long-term care side of the building. Very, very few people stay in long-term care unless they are on Medicaid. And Medicaid is the program for people, and people interchange these words all the time, the difference between Medicare and Medicaid. Medicare is the program that everybody goes on when you turn 65, sometimes earlier, but mostly when you turn 65. Medicaid is the program if you are lower income, and you can go on that really at any age, if you qualify for it. So a lot of people in skilled nursing facilities are in there in the long-term care side because they don't have any other options. They're on Medicaid, and they got a Medicaid bed, and that's where they have to go. If you do have options and you do have resources, very, very few people are in these facilities paying privately for long-term care anymore. Number one, it's very expensive, and number two, if you do have those kind of resources, it's generally not the place where people want to be. So the good news is there are a lot of other options out there, which I'll touch on briefly. Number one is independent living. I work with a lot of people who just can't keep up with their house anymore, don't want to keep up with their house anymore, they're ready to downsize, so they go into independent living. And there's really two types of independent living. There are 55-plus neighborhoods, and those are basically age-restricted condos or townhouses with some community activities. They have maintenance-free living. And usually people who are in these buy these houses. Sometimes you can rent these houses. But they are very, very independent. You know, you're living in your own space. Some examples of communities like this is Cross Ridge is one in Glen Allen. Mosaic is one in, it's right over the line in Goochland. Chickahominy Falls near Ashland. These are all 55-plus neighborhoods. Now, there's also 55-plus communities, and these are rental apartments in a building. And the picture that's up there, I think that's Verena, which is a community in Glen Allen. And these communities, you pay a flat fee, and that fee includes your rent. It includes, most of them include at least 1 or 2 meals a day, some of them 3 meals a day. There's some security there, there's pull cords, people get pendants if they need help. there's housekeeping, there's activities, et cetera, et cetera. There is not care there unless you pay separately to bring home care in. But for a lot of people, living in an environment where you don't really have any home maintenance, you don't have to cook, a lot of times people will do very well in these settings and avoid needing further care, at least for a period of time. So the advantage of independent living is it's less expensive than going into assisted living. There's safety, there's socialization, there's interaction with peers in that environment. The negatives of independent living are you may have to move again if you end up needing care, unless you want just part-time caregivers coming in. So another type of community that's out there that a lot of people have heard of are these continuing care retirement communities, also known as life plan communities or CCRCs. And these are the buy-in communities. And they are designed to allow you to age in place. You go in when you're independent, and then if you need help, you go into assisted living. If you need further help, you go into memory care or a skilled care setting. There are financial as well as health requirements to get into these communities. And they do have a significant financial buy-in required in this area. And it depends on the type of housing you're getting. If you're in a cottage on the campus, that's going to be the most expensive way to go. If you're in a 2-bedroom apartment, that's probably the next step down. If you're in a small studio, that's probably the least expensive way to go. But when you go into these communities, the buy-in can range anywhere from $300,000 or $400,000 up to $900,000 just to get in the door. So they are pricey, and then on top of that, you pay a monthly rent. So they're not cheap. Some examples of communities like this you've probably heard of: Westminster Canterbury, Cedarfield, Covenant Woods. These are all CCRCs. And the optimal time to go into a community like this is probably your mid to late 70s, so that you are healthy enough, well enough that you can enjoy all the amenities while you're there. So the advantages of a CCRC setting, it's care for life if you need that. It's very upscale, it's very nice. It is oftentimes on a campus-like setting, so it's a very nice environment to live in, and there's a variety of living options. The disadvantages, it's expensive. It's a lot of money to get in the door to these places. The other part is it's tough to leave. If you don't like it, you can leave, but you're going to take a pretty big financial hit depending on how your contract is set up. All right, another option would be assisted living. Assisted living, pretty much everybody's heard the term or the phrase assisted living, but a lot of times people are kind of uncertain as to what it really is. So assisted living is basically, it's assistance for people who need help with their activities of daily living, or ADLs, but they don't really require that medical or nursing care all the time. And so people who go in there typically will need help with things like medication management, like I talked about earlier. They'll need help taking bathing. Not necessarily hands-on bathing assistance, but they just need somebody nearby because they're afraid they're going to fall while they're in there. They might need help with dressing or with transferring. They might be in a wheelchair and they need help getting out of their wheelchair into bed or into a chair. Or they might be, have difficulty walking, so they need somebody to walk with them or push them in a wheelchair to go places. So that's what these communities do. There are a wide variety of options in the Richmond area. I think at last count there was over 70 different options. Honestly, I hope they build more because it is getting challenging finding availability in these communities, especially for larger apartments. You know, when married couples come to me and they want a big apartment, it's tough. It's really hard finding them now. And that's been a change over the past couple of years. That used to be you could always find something, but now there's pretty much, it's a waiting list situation. So the thing about these communities is most of them, especially the newer ones, are beautiful. You know, they are just really, really nice environments. But you also have to not get caught up in the aesthetics of the community. You have to look at the quality of care. And so these places, again, they're not cheap. They're not as expensive as the CCRC model, but they're still not cheap. Most communities have their version of a buy-in is what they call a community fee. So, but instead of charging hundreds of thousands of dollars to get in, it ranges anywhere between $2,000 and $5,000 is probably the highest I've seen. So $2,000 to $5,000 is the entrance fee, and it's a one-time thing. The rent at these communities in this area now is going to be probably in the neighborhood of $5,000 a month, maybe slightly higher. You have to factor in all of these places charge a base rate, and then they have what's called level of care charges. So depending on the amount of care a person needs. Now, one thing to keep in mind is if it is a married couple, it's not double. They just charge a second person fee, which is much reduced. So it's typically not, you know, twice that amount. It's less than that. Assisted living can be a great option for people. Lots and lots of social interaction. You know, all meals are included, all activities, housekeeping. You know, everything's right there if you need it. But the biggest advantages of it are the safety and socialization components. The downside to assisted living is you may have to move if skilled care becomes necessary. That's a very rare occurrence today. Assisted livings can handle a very high level of care, and they are designed to allow aging in place. And later in life, if needed, hospice can certainly come in and help as well. So it's pretty rare today to hear about people who have to leave assisted living and go into skilled nursing, unless they've had, you know, they're going for a short-term stay. All right, the next option, just to touch on, is a memory care setting. And this would be for people who have a cognitive impairment. Most assisted livings have a separate memory care wing, and the difference between it is in memory care it is a secure setting, which basically means the door is locked, so a person can't walk out. In assisted living, people can come and go, and so if a person is potentially a wanderer or they're a flight risk, sometimes they need to be in a memory care setting for their safety. But it is specialized care for people with dementia, either Alzheimer's or another form of dementia. They have a staff that's trained to work with people with dementia. It's also a higher staffing level in there. There are some exclusively memory care communities in Richmond, but most of them are attached to an assisted living. Cost range, again, it's not cheap. It's more expensive than assisted living to go into memory care, typically in the range of $7,000 to $8,000 a month for that. All right, advantages, staff are trained to handle it, higher staffing levels. Disadvantage, if you have a spouse with dementia and you don't, generally you cannot live together in memory care. That would be a tough environment to live in for the spouse who does not have dementia. All right, another one just to make you aware of are care homes, because this is, I feel like it's a great option that a lot of people don't know about. A lot of times people mix up care homes with group homes. They are not the same. Group homes a lot of time tend to be for younger people, often with mental health or addiction issues, things along those lines. Care homes are designed for older adults who have either physical or cognitive issues or both. Most people never know these places exist. They're in a neighborhood. They've been modified for older adults. And generally, there's anywhere between 3 and 8 people living in the home. There's caregivers there with them around the clock. These places don't have all the bells and whistles that an assisted living or a memory care community has. You know, there's no full-time activities director. There's no, you know, bingo at 2 and the band coming in at 4, you know, things like that. So it's much, much more low key. But for people who've reached the point where care is the critical thing, these care homes can be really, really good options. There is in Virginia, care homes can be either licensed or unlicensed. Virginia says you can have up to 3 people in a home and a license is not required. If you have 4 or more, it does have to have a license, and it's the same type of license that the larger assisted living communities have. State inspectors come in, there's rules they have to follow, just like the larger assisted livings. This model is becoming more and more popular. It is the prevalent model on the West Coast, and it's coming further east. And I think it's grown even more since COVID because the care homes, their residents did much better in that smaller setting. There was much less COVID issues in these settings than in some of the larger settings that we all heard about on the news. So advantages, home-like, usually less expensive. Disadvantages, they are often full because they're so small. There's fewer activities. There's a typo, rarely advertise. So, you know, how do you hear about them? It's a lot of word of mouth. It's, you know, talking to people like me, calling Ashley, you know, things like that. And these pictures I showed you, this is an actual care home down in Chesterfield. So some of them, I mean, this is a nice one, but you know, some of these places, again, it looks like home. And so I work with a lot of people who have started off in larger memory care communities. Families can sometimes no longer afford it. And so, you know, they move into these smaller care homes because they do tend to be cheaper and it's more hands-on care. So the bottom line with all this, and I'm sorry I've kind of like zoomed through all this, but I wanted to get this information out there, is there are options. There's a lot of options out there. There's a lot of different programs out there that can help you as a caregiver and give support to your loved one if you need some help. Last session, Ashley, didn't the person talk about the GUIDE program at all? Okay. So, any of you heard of the GUIDE program? Okay. GUIDE is a new program started by the Center for Medicare. And basically what it is, it's a program to give caregivers support who are caring for somebody with dementia. And basically, it's not huge, but basically it is a stipend that can help pay for some care and some respite for a caregiver who needs a break. Now, I think it is a new program. They are basically trying to still get their act together a little bit with it. And I've heard just this week, somebody tried to apply for it and they said they're not taking any further applications right now. That doesn't mean forever. I think they're just trying to get everything straight. Basically, what has to happen is your loved one has to have a diagnosis of dementia. They have to be on Medicare. They do not accept Medicare Advantage plans. And it will pay for a certain number of hours for caregivers to come in to give the caregiver a break. So it's a good program. It's a great idea. It's definitely a needed program, but it's not going to provide 10 hours of care a day by any means. But if that's something you're interested in, let me know. I can try and put you in touch with some organizations that do that. It's also not a fast process. It can take a couple months to get it kicked in. A woman who works with me, her mother has advanced Alzheimer's, and she signed up for the GUIDE program, and it's taken about it's just kicked in for her, and it's taken about 2.5 months. So it's a process to fill out the paperwork. You have to meet with them, and it's a process.
I also want to say, if I was given your email address, I will plan to send out, all of our sessions are being recorded, so I'll plan to send them all out to you. You will have my contact information. I'm the advocate for the aging. You can call me, and I will return your call, and I will get you resources. And if I don't know, I'll take some time and do some digging to try to get you what you need. So please don't hesitate to reach out about those things. We do have a couple more things going on. So next Tuesday is our last Caregiver Series event, and we're having a representative from Crater Community Hospice join us to talk about the difference between hospice and palliative care and how to start having conversations about end of life with our loved ones. So I think that'll be a really good, difficult conversation to have together. And then our Caregiver Series is wrapping up with an expo. So our Caregiver and Senior Expo is March 25th. It's going to be across the street at the rec center. It's from 10 to 1. We have over 50 vendors lined up to talk about what they're doing in the community to support our older adults and caregivers. So I hope you can be at that one as well. This is my information. Please feel free to jot it down or take some flyers with it. And then lastly, I'm sorry to move us so quickly, this is our survey. So if you're able to scan the QR code and provide some feedback, we also have a paper survey. If you're willing to provide some feedback, that way we'll pass it out to you all. We're gonna stick around. So if you have questions, if you have specific questions about some fun activities in the community to get plugged into or some support groups in our area, please talk to us. We're all here for you. All right? Thank you. Thank you so much.